Our topic this evening is Hipaa, and most of you have already heard the term. Whenever the VNA Community Services orients a new employee, they specifically review Hipaa and they have them take a test. But after people have worked for us for a number of years, sometimes some things are forgotten, and it is very, very important that we remind each other. So I'm going to take some time to review all the details. Awareness training for the VNA Community Services in regard to Hipaa is that we want you to know what major violations are found in home care, like talking about a client in public places such as hallways, laundry rooms in apartment buildings, parking lots, outside elevators, and grocery stores. Talking about another client to the supervisor while in a client's home. VNA employee calls a client's home and the home care aide talks on the phone, which is not in a private area. So somebody overhears information that they shouldn't hear. VNA calls the home care aide who is in a client's home, and the client's family member picks the phone up and calls out to the home care aide that VNA Community Services is on the phone. The home care aide speaks to the caller. Maybe it's a scheduler, maybe it's a nursing supervisor, but they start speaking without making sure that someone else has hung up the extension phone, so that maybe actually someone else is still listening in on the conversation. Taking a client's driver's license or access card with you after leaving the client's apartment or home. Careless use of clients' plans of care. We know it's important to have a plan of care for each client, to review it carefully before you enter the client's home, but making sure that plans of care are not visible to other clients and making sure that they're disposed of properly. Now, Hipaa is a national standard to protect medical records and other personal health information. And it is called the Health Insurance Portability and Accountability Act. The abbreviations are HIPAA. So what is Hipaa? It's a law passed by Congress in 1996. It sets national standards for the protection of patient information, and this was a requirement of everyone, and the deadline was April 2003. So here we are, 9 years later, and it has absolutely been in effect. Hipaa applies to all healthcare providers, hospitals, physicians, insurance companies, labs, surgical centers, and home care companies. Hipaa covers all forms of protected information, oral, written, and electronic. Now, why do we involve all staff in the Hipaa training? Because it is everyone's responsibility. So what exactly is protected health information? What can actually identify the clients that we're serving? Well, obviously their name and address. It's right on the top of the plan of care. Dates, telephone or fax numbers, social security numbers. Now, they are not on our plans of care, We have them only on our private original charts that are in a non-public area. Medical record numbers. We have a medical record number. The VNA-Community Services assigns a number. They are entered into the CareWatch national system by a number. Insurance plan numbers, we don't get involved in. As a nursing supervisor, when I do the assessment on a new client, I do not ask for their medical insurance. But vehicle information, but we can have that. We have vehicle release forms, and sometimes the home health aide is allowed to drive the client's car. So that has a number of personal numbers and information on it. The license number of a car, driver's license. If an aide has picked up a Pennsylvania driver's license for the client to take along with a check to be cashed for the food purchases. Medical equipment numbers, that doesn't normally pertain to us. Photographs, that doesn't normally pertain to us. Fingerprints, email addresses, internet addresses. This information is referred to as individually identifiable health information. And any health information that identifies someone or can be used to identify someone must be protected. So, sharing patient information. Hipaa, under the consent rule, allows for the provider of care to use information for treatment, payment, and operations. Before Hipaa, it was common to use patient information for other purposes and to share more than minimum necessary information. But now, patients need to give prior authorization for use of their health information for non-TPO purposes. Under the minimum necessary rule, aides should only have access to information they need to fulfill their assigned duties. And that is the purpose of our plan of care. So again, what is TPO? Treatment, providing care to patients, payment, getting paid for caring for patients, and operations, normal business activities such as quality improvement, training, auditing, customer service, and resolution of grievances. So this definitely does cover, even though we're not a hospital, this is covering what the aide is doing in the home, and it's covering what the staff is doing here in the office. So if use of this information does not fall under one of these categories, you must have the patient's signed authorization before sharing that information with anyone. What are the consequences of not complying with the law? It has always been against policy to improperly share, use, or dispose of patient information in the wrong way. Under Hipaa, there are now fines and penalties for this. Whenever Eileen and I go out to open a new case, we have a number of forms that have to be signed by the client. We always leave a copy of that form with the client in his own personal chart. One of them is entitled Client's Authorization for Record Information Release. I always explain to clients that this is a general form, that we need permission. And that means for the nursing supervisor, I need permission to talk to their physician, to talk to their physical therapist, to talk to maybe somebody special that's doing a special evaluation for them in relationship to the care that we're providing, a care manager from the county, and possibly if it's a protective service case, that it would be a matter of maybe even possibly care coordinating with the police in the local area. But I need permission. We treat privacy seriously, which is why every aide and team member is required to sign a confidentiality form. And if you've worked with us for a while, maybe you forget the form that you signed when you originally became an employee. But it specifically states that if you do misuse information, that there can be a written discipline and/or termination. These offenses and violations are very serious, and your signature on this confidentiality form has stated that you will observe the limitations. A breach of privacy can mean that the agency could receive a very large fine. There are repercussions. And in 2011, there was a home care agency in Seattle that had to pay $100,000 for a violation. That is something that would be extremely hard for us as a charity, for our public relations in the community. And also, when something like this happens, it hurts all of us. So it's really important that we all work together on these issues. I'd like to specifically address the plans of care. When they are not needed, please come into the building and shred them here. If you do not have a shredder at home, and cover your plans of care when you're in patients' homes so that they cannot read information that pertains to other people you're helping. So why should we do this? It is the right thing to do. It is in keeping with the values of the VNA Community Service. And think how you would feel if personal information about you or a loved one was misused. People in healthcare think that they already do a good job. And I certainly can attest to the fact that my team members do. But HIPAA requires more than protection. No one wants to feel like a criminal. They really want people to see all the good things they do and how their experience and their training makes them effective. So we need to be very careful that something does not spoil that. What is new with patient rights? Well, under HIPAA, patients have the right to know how their health information may be used or disclosed, that they have certain privacy rights. And I think the general population really knows this now. And these rights, some new and some revised, are communicated through a document called Notice of Primary Practices. And these are the rights. They can obtain a list of who we have shared their health information with for the past 6 years. They can request to amend their medical records. They can request other communications, such as asking to be notified of lab results only at work and not at home. And I know this from my own internist, because they have specifically asked me in regard to this. Now, here in the VNA Community Services, we don't get involved with lab results unless someone is very hard of hearing, and then as a service to them, we are communicating to them the message that their doctor has given to them on their phone. Before HIPAA, it was not uncommon for patients' privacy information to be given to other companies for the purpose of marketing products or services. So now HIPAA states that you must get the patient's signed authorization before doing this. And this is not something that the VNA Community Services is involved in any way. We do need to think about computers. Properly signing on with individual ID and passwords, signing off of computers, walking away from the desk, keeping IDs and password confidential, and protecting computer screens from unwanted viewings. This certainly is true in our office. Through proper disposal of information, I already addressed that with the shredder that is in the upstairs Xerox room, and any use of email and faxes that can be received must be handled with care also. Now, reporting violations. It's everyone's responsibility to report violations or wrongdoings, and whether someone received patient information improperly or shared patient information in the wrong way, everyone has a responsibility to report violations, and when in doubt, ask. Now, Sam Cordisco, the Director of In-Home Services, addressed these issues twice. Most recently at the in-service in the spring, and he did so because of very definite concerns that patient information is carefully guarded in each of our situations. Your supervisor or director is a good place to start for answers to your question if you're unsure about something. And it is very good for us to remind one another if something starts to be said in a place that is not private. I'd like to thank each one of you for being as careful in your work and your outreach. All of us are capable of sometimes just slipping, forgetting, not thinking anyone was around. And yesterday, a home health aide took a driver's license home with them, and that is a HIPAA violation. The driver's license was returned first thing this morning, but that is something that cannot be done. I have encouraged all of my team members to try to keep information separate, not in their pocket, not in their handbag. I bought a lot of these colorful zipper cases from the dollar store, which I'm happy to donate one to each of my team members if they feel it will be helpful. That they can put the shopping list, the access card, the money or the check, the shopping list, and then when they get back to the client, review the receipt, return the access card, return the Pennsylvania driver's license. This is extremely important. So we want to be part of this together so that nothing spoils the really wonderful outreach that each of you is making for our agency. Thank you.